I'm Matt Buter Shapiro, co-founder and chief marketing officer of medpilot, a leading AI-driven patient financial engagement platform. I partnered up two co-founders, Jacob Myers and Nathan Spoden, who both came from the world of revenue cycle management consulting. They noticed that a lot of attention was being paid towards helping healthcare providers better collect from insurance companies. Patients, on the other hand, were always an afterthought. This changed with the rise of high deductible health plans that caused the patient portion of the healthcare provider's revenue to dramatically increase. To combat this, billing departments started using one-off patient tools. All of these became expensive, they didn't integrate, and they ultimately would usually lead to increased patient inbound inquiries and lower satisfaction. We founded medpilot to transform the patient's financial experience. We use AI to synthesize patient behavior to engage patients more efficiently and effectively. Our goals are to increase patient collections as a whole, reduce the time it takes to resolve balances, to reduce costs as a whole, such as fewer patient statements and manual phone calls, and to boost patient satisfaction, all in one patient billing platform. To date, we've helped over 1 million patients better understand and resolve their medical expenses. We've been able to reduce the average collection time by almost 50%, to increase self-service payments by close to 20%, to increase collections as a whole 15%, and to maintain a 97% patient satisfaction score, which leads to higher retention. So how does this work? Our first step is integrating with the client's practice management system to pull out the data we need to power our platform. Next, we set preferences with the client around outreach campaigns and payment options to match the client's specific situation. We then group patients using a variety of variables, including patient demographics, bill size, payment history, in order to personalize engagement through emails, texts, statements, and phone calls, all while learning and optimizing our approach based on what's working, what isn't. After all, not every patient's just going to click a link and pay their balance. You're going to get a lot of inbound inquiries based on sending out engagement. And our special sauce is how we handle all of this inbound communication with our workflow engine. Each different patient situation drives a different action, and we track all of this in our workflow engine. I'd love to give you guys a quick little overview of our product. There are two main facets of the medpilot product: our payment portal and our internal CRM system. The payment portal can be accessed through a paper statement, a text message, or an email. This is the view that a patient would see if they're coming off of a paper statement. If they're coming off of a text message or an email, the URL would be tokenized and they'd be able to come directly to a white labeled platform with their healthcare provider's brand. Coming from a paper statement, they enter in an easy account number to access all of their information. Here, they can see both their patient demographic information as well as all of their open balances. You can click in to view an individual statement that we built in a clean and easy to understand fashion. If everything looks good, you can pay now and resolve your balance. However, if you have any questions, you can see if they can get answered on our patient help center or through our secure messaging application, where you can chat back and forth with an internal representative. If there's other disputes that you'd like to work through, you can easily submit a dispute log that includes submitting primary insurance, secondary insurance, or if, for instance, you wanted to enter in any financial assistance or help with paying your bill. If it's the secondary insurance, you would just simply enter all of your updated info, as well as take a picture of your card, and you could easily submit your dispute so that it can be resolved quickly. All of this is stored back in the healthcare provider's CRM system. Here, you can view all of the disputes from your accounts and assign them to different members of your team, see all the back and forth communication, and approve the accounts. If you have more questions and you want to look a little bit deeper into each patient's situation, you can pop into their individual account. You can click into any number of accounts that they have open, And you can see both the transaction level data that we pull from the practice management system, as well as any activity that's taken place on the account to give you the most holistic view of what's going on. In this product, you can also manage all back and forth SMS. You can request letters, incoming documents. You can handle all refunds. You can monitor your agents to make sure they're working efficiently. You can handle all of your reporting out of the tool. And you can do all outbound communication, such as appointment reminders, surveys, billing communications, marketing, and our proprietary dialer system. Our product was built from the ground up in order to help billing departments handle patient inbound and outbound communication efficiently and effectively, not just reducing costs for the billing team, but also increasing patient satisfaction for the patient. MedPilot's done a lot to adapt to the new normal. Firstly, over the past few months during the pandemic, we switched our entire company to working remote, which helped expedite our product's ability to manage call center teams that are dispersed all over the country. Our internal team is based in Cleveland, Ohio, but we work with revenue cycle management teams that are all over the country. And our product now has the ability to combat this different change in events by working with healthcare providers across more than just financial engagement. We've bolstered our product with survey reminders, with appointment reminders, with remarketing notifications, and all of the important facets of the engagement lifecycle to ensure that patients can be kept in the loop during the COVID pandemic. We've also positioned our company around more than just financial engagement, because it's important to note that while paying a bill is an important part of the patient experience, there are many other touch points that we want to be focused on for our healthcare providers and billing companies that we work with. A lot has changed during this time as the economy has reopened, but MedPilot is positioned strongly to help patients and healthcare providers navigate through the patient experience in the most efficient and effective way possible. Thank you so much for your time.
All right, that was excellent. I've never before seen a recorded demo within a recorded demo. That, my friend, was strong. Matt from MedPilot, welcome up here. We've got a question already submitted. Others, if you have it, please think of them and throw them out there. Matt, I'm going to toss this one at you first. What is an example of a customer relationship with a large health institution that you're proud of, if you've gotten to that point?
Yeah, so primarily we're focused on small and medium-sized healthcare providers and revenue cycle management companies. But we're really excited ever since we moved from New York City to Cleveland to have an opportunity to work with some pretty large groups in Ohio. And we're currently working with affiliates of both the Cleveland Clinic as well as University Hospital Systems.
Awesome. While we're waiting for other questions to come in, I'll ask one or two. I am by no means, I'm whatever the farthest thing away from a healthcare expert is. So I'll just ask you this question from someone who uses the health industry from time to time, and also someone who's in the fintech world. So what made you guys build something to fill this space? I've read books. I understand in the 80s and into the 90s, particularly, people tried to come in and create tech solutions to solve the spaghetti bowl that is the healthcare industry, and they did not do well. And I'm just curious, what gap were you guys looking to fill? And is that gap kind of on the edge a little bit and a piece that can be bit off, or is it woven into insurance and providers and this and that would cause for challenges?
It's a really great question. And like yourself, I don't come from healthcare. I actually used to run the New York media team for the largest political marketing firm. And so I'm very familiar with engagement and communication, not as much in healthcare. And like probably everyone on this call, I was a little surprised when I learned how big this industry was and how most of us are predominantly still communicating with our healthcare provider through snail mail and paper statements and manual phone calls. And I definitely couldn't have done it without teaming up with some people who did have the healthcare experience to help us navigate this. But, there's been a lot of developments on working with the healthcare provider and the insurance company, because that's predominantly where all the money is. And lately, as high deductible health plans have taken a bigger role in the overall payment side, suddenly the patient is a little bit more important for healthcare providers, and making sure that they can understand their bills and come back in the door afterwards is really important.
All right, lightning round before we end. You ready to go? You know what lightning round is, right? We go fast.
Oh, yeah.
How do you plan to integrate with Epic Cerner? I don't even know what those words mean.
We integrate with pretty much every EHR and PM system. It's never had a problem.
Good enough there. What does the pilot process look like for you?
We can get it up and running in about less than a week, depending on if you're on the EHR PM that we've already worked with. If not, it's closer to 2 weeks.
That's it. You know, my friend, what lightning round means. Matt, medpilot, excellent job. Thank you for being with us today.